Dr. Kemi Health. I'm Dr. Kemi. It's still Saturday, the 22nd of February, 2025. Let's talk about drug, food, and drug-drug interactions. This is very important. Make this video viral because it's a problem across the world, especially in Africa and particularly Nigeria. What is going on is that in this life, we take some drugs with other drugs, and we have an interaction, and then something bad happens to us, including death. The other thing is drugs in food. There's some drugs that you cannot take with certain foods, some foods you can't take with certain drugs, and they've also caused death. I did a study in 2015 in Nigeria, and I discovered about 350 Nigerians died yearly from drug-drug or drug-food interactions, and they didn't even know what killed them, and their families didn't know either. This is so important because I found that in Nigerian pharmacies, there's a very low rate of counseling. In America, we are required to counsel you after we put a drug into your hands. They even pay us for it over there. So at the end of the day, it's very important for people like me to continue educating you. This is my 36th year in pharmacy, and let's start with the ones that you need to know. Like I said, share this and make it go viral. The common ones, tetracycline. If you are on tetracycline, and a lot of you are going to be on it these days with hookups and all this prostitution going on, tetracycline is one of the first-line drugs for STDs. Don't go to pharmacy and buy it and self-dose yourself. You must see a doctor. But doctors do give tetracycline a lot, and they do what they call a stat dose. They might say take 4 of them at one time, or maybe 4 times a day for a certain amount of days. Okay, dentists use it. Doctors use it for different infections. It's in a class of drugs called macrolide antibiotics. Okay, the macrolides usually end with the same cycline thing, doxycycline, tetracycline, this one's cycline, that one's cycline. But doxy is very common in STDs and tetra. So those drugs, all right, they have an interaction with food. What food is that? Dairy products. In other words, if you go to the pharmacy and somebody dispenses doxycycline and tetracycline, they'll tell you that you should not take it with dairy products within 1 hour or 2 hours after the dairy products. Okay, all that's confusing, so let me make it easy for you. All right, so I just got tetracycline for my dental work, and I did have dental work about 3 weeks ago. The doctor gave me tetracycline because I had to take a bone out. I was having a root canal, okay, and I'm getting a crown and everything, and there's a bone here. This is the teeth, by the way, this one. See the that's the one. I had the root canal. See how white it is? That's a new crown. Very expensive. But there's a bone here, see, in your skull, the jaw. And they had to clean inside that area, okay, to get the root out and give me my crown and everything. That's why root canals are very expensive and very painful. So before I did the procedure, the doctor gave me tetracycline. Told me to take it for 4 or 5 days, but I did. It's like pre-treatment for the infection. Now, 4 times a day. So in the morning I wake up, I take my tetracycline. I have to wait, okay, 1 hour before I eat the cornflakes and the milk. Do you understand what I'm saying? Or before I drink the tea with the milk. Anything with milk or any dairy product, I have to wait the 1 hour. Now, if I take it, okay, after an hour I can eat dairy products. Or 2 hours after the dairy product. Let's explain that one to you. The next dose is in the afternoon. I'm in my office and I need my next dose of tetracycline. I just had pizza for lunch. There's cheese in there. And I had an ice cream with that pizza. That's dairy products. So I can't take it right now. I have to wait 2 hours after I ate that pizza and the ice cream. Do you see what I'm saying? 1 hour before, 2 hours after. Dairy product, cheese, milk, anything that contains dairy product, ice cream. What is going to happen if you take it together? It wouldn't work. That's the drug-food interaction with macrolide antibiotics, the cycline drug, doxycycline, tetracycline. It will just sit there in your system. It will not work for the infection. So you know how to take it now. Number 2, let's go to ibuprofen. You call it Ibuprofen in Nigeria, the way you pronounce your I. Ibuprofen, whatever you call it, okay? In America, it's marketed as 600 and 800 prescription, but Nigeria ends at 400, period, over the counter. When you take ibuprofen, you must take it with food or milk, okay? If you don't, your stomach is going to be twisting and paining you and twisting. You can't take ibuprofen, or however you call it, you cannot take it on an empty stomach. You have to take it with food or milk. If you take a glass of milk and drink it, is the glass of milk actually accessible all the time? No. So, Nigeria, we have our yogurts, or how do you say yogurt? We have yogurt, drinkable yogurt. It's not common in America, but Nigeria, Africa likes drinkable yogurt. Yogurt that Fanice that you can drink and all those different ones, okay? Shout out to Fanice, by the way. Make sure you send me a carton of stuff for one year. I called your name in my video. But at the end of the day, I like Fanice. You can get some, you can drink your drinkable yogurt or, you know, anything that's going to mimic food. If you have food, eat your, you know, meal. Take it about when you're about to eat, or when you finish eating, take your ibuprofen dose. Now, let me tell you another thing you can do with ibuprofen. Okay, this is what dentists like to do. When you go and do a procedure and they're going to give you lidocaine injection, they're going to ask you if you've eaten. There's a reason, because some injections you have to have food in your stomach. So they tell the nurse, Laura Maltzwa, go and buy malt. If you don't have anything to take that ibuprofen with, use malt. Malt has a lot of calories. If you look at the back of a malt, it has these, some of that malt, when you see the number of calories, just look at CAL, cal. It's actually the same amount of calorie as if you eat one swallow, two more meats, and ewedu or any kind of soup. You know, it's actually the same amount of calories, so you can actually drink malt with the medication. That's another very common one, okay? I saw a girl who posted online that she almost died. The pharmacist almost killed her because they gave her this drug. It was only ibuprofen, and she didn't take it with food, so her stomach felt like she was going to the grave. That's how it actually feels, okay? The final one I want to talk about is blood pressure medications in the classification of calcium channel blockers, okay? The pitting drugs. I call them the pitting drugs. Amlodipine, the very, very common amlodipine. Okay, amlodipine, nifedipine, any of the calcium, just Google it, calcium channel blockers. Africans don't know what medications they're taking. All the time, hey, what's the name of your medication? They didn't tell me because they didn't want me to go and buy it outside. Ask the doctor what you're getting. Take your piece of paper and your notebook to the doctor and write it down. Because if you have an emergency, the next doctor will know what you're on. Okay, amlodipine, nifedipine. Anyone taking that class of blood pressure medications should be very careful with grapefruit. Do you know what grapefruit is? This is the fight that I had with the cable NG. You know that fake news platform that posted Mobad's toxicology from America, the fake one, you know. I don't have respect for cable NG. I hope the editor is watching. They're very stupid over there. I had a fight over that with them. They hired a girl who was a health reporter. She was calling me to say I gave false information or fake information out with regards to what can happen if you take amlodipine with grapefruit. The idiot was talking about grape. Okay, African journalist. Grapefruit is a citrus. It looks like an orange. It's bigger than the orange. If you cut it open, okay, it looks like an orange. Sometimes it's pink inside, and they call it pink grapefruit. Okay, that's grapefruit. Grape is different. This local illiterate girl thought I was talking about grapes. So she messed up their article and disgraced them. I replied her. I called her and I blasted her and I blasted the editor. So at the end of the day, it's not great, okay? That my video went viral because their platform is big and they used it to defame me. But I didn't bother with them because all these people are illiterates. They're not as good. How can you be arguing with a journalist who's 31 years on the job and a pharmacist 36 years? We're telling you grapefruit. So grapefruit, okay? Don't confuse yourself. Grapes are those little green and purple and black ones you eat one by one. They grow on vines. Grapefruit is like orange, okay? Do not eat grapefruit or drink grapefruit juice when you're on amlodipine or nifedipine. It can cause arrhythmia. Cardiac arrhythmia is when your heart starts racing, and people have died. Okay, in 1995, a couple of people died in America of cardiac arrhythmia, and that's how they came up with that drug-food interaction. I hope I educated you about drug-food interactions. Pass this video to the next person. Be safe. If you have a question, put it in the comments.